In this video, we will cover a hair trend that has resurfaced, more armpit hair, and what could be done if it has been lost. We will showcase a patient who has had an underarm hair transplant in my practice. Stay tuned until the end for his before and after photos. In July of 2022, the Wall Street Journal released an article called "Armpit Hair is Back, Whether You Like It or Not." Celebrities from Julia Roberts to Emma Corrin have sported a hairy armpit look, from movie premieres to the covers of magazines. Model Emily Ratajkowski once said, "Sometimes letting my body hair grow out is what makes me feel sexy." Some speculate that the growing trend has to do with an increased openness in gender expressions. For others, it's simply more comfortable or more efficient, less irritating to their skin, or in keeping with cultural or religious beliefs. So my patient was a 41-year-old musician who suffered from hyperhidrosis, which is excessive sweating, and he opted for a procedure called Mira-Dry. Now, the Mira-Dry system uses thermal energy that targets and eliminates the sweat glands in your underarm area. After a few rounds of Mira-Dry treatment, my patient developed central underarm hair loss on both sides. Mira-Dry removes up to 70% of underarm hair as the heat damages the hair follicles. Most of the time, for the majority of people, that's actually a welcome side effect. But for my patient, who's a rock musician and who wanted to keep his hair, it was a real issue. For my patient, the donor area was the occipital scalp, which is the back of the head, and we used the FUE method of extracting grafts. The plan was for about 700 grafts total, and we ended up doing exactly that, 350 grafts per side. We used the WA system, the WAW WA system, that was first invented by Jean Devroy, and this was using a 0.9 millimeter punch. For the recipient area, we used a blade with a size of 0.6 millimeters. Some of the challenges related to this case were the numbing. So the numbing has to be done in a very specific way to reduce the discomfort that the patient feels when they're undergoing this type of surgery in a very delicate, sensitive area, the underarms. Also, it's important when making sites to follow the hair angulation of the area and make sure that the spacing is similar to the hairs that's around it. It's different spacing than, say, the scalp, where the grafts and the hairs are much closer together. In the underarm, they're usually more spaced apart, and you have to observe that when making sites. Also, placing grafts is more difficult in the underarm region compared to, say, the scalp, because the tissue is a lot more mobile. So you have to be very astute at placing grafts in order to do this well. As far as recovery goes from this type of procedure, underarm hair transplant, it's important to make sure that the patient does not rub the grafts off mistakenly in the recovery period, because even walking out of the clinic, you have to somehow move your arms, and any type of movement could potentially rub the grafts off. And I was super delighted that my patient was very conscious about that and really did a great job when it came to preserving the grafts that we had placed. Also, it's important that the recipient sites are made in such a way that it's a good fit with the grafts themselves. If the sites are too big, then what's going to happen is that the graft isn't secure and it's more likely to fall out in the recovery period. One other point to bring up with underarm hair transplant is that a discussion I have with patients is that, look, like, you have limited donor supply on the scalp, right? And so if you're going to invest some of those grafts, some of those valuable grafts, into the underarm, just realize that you may have then fewer hairs that can go onto the scalp if you so choose in the future to get a scalp hair transplant. It's just something that people ought to keep in mind, whether we're doing eyebrow hair transplant, beard, underarm, any place other than the scalp. Just important to tell people that, hey, the donor supply is limited and we're borrowing from that supply to bring grafts to your desired area. But then in the future, if you choose to do something back on the head, you're going to be working off of a more limited supply. You can see in this clip the markings that were used, and we filled within those areas. We just made sure to try to have it blend in with the surrounding area and really focused in on the area of interest for the patient. As far as the recovery went, for the patient, we asked him to avoid getting the underarm area wet for at least 1 week. And ultimately, the little shafts that were there and the crust fell off, and then the new hairs from the grafts that remained started to sprout as early as 3 months after the procedure. The images that you see at the end of this video are at 10 months after surgery. So here you can see the results from my patient's underarm hair transplant surgery. You can see the results on the right hand side and on the left hand side. So you can see that that central area that was affected by that mirror dry procedure is now much more filled in. There are still small areas that maybe didn't completely take. Overall, this is a really nice improvement, and my patient was thrilled that now he's able to go and perform as a musician and be less self-conscious about the types of shirts that he wears and how things look when he lifts his arms. So overall, successful procedure, one that isn't the most common type of hair transplant, but in the right candidate, it can be a very useful and beneficial procedure.